Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins us. Hey, Chris.
Hey, good morning.
Things are getting pretty serious. We've got Omicron now responsible for more than 80% of our positive tests here in the state.
That's right. Latest results from Indiana Department of Health surveillance system is that I believe it was 82.4% for the week of December 27th. So, we're looking at some historical data. So there's a good chance that number is even higher now and could potentially be 100%. I think, the silver lining of that message is that Omicron seems to be less severe in those vaccinated as well as those unvaccinated. So while it is more infective, it seems like fewer people are having severe symptoms.
Yeah, let's talk about that. As a parent, we just had our first case of COVID in the house this week. Everybody's vaccinated, everybody's boosted, yet they still got sick. It's leaving a lot of people feeling like, well, what could I do or what could I have done better?
It's incredibly frustrating. I certainly understand the concern. I think every household's going to go through this at some point or another. And, one of the biggest things is you can't beat up, yourself or whoever else for causality. It's a virus. It doesn't know and it doesn't care. Did a child get it from school? Did you get it from a coworker? Did you get it from the Uber driver? At this point, you kind of need to do what you can. And, one of the big tenets of public health preparedness as well as emergency management is mitigation. And this is what the vaccines do, is they provide that mitigation for you. They do everything they can to prevent. Unfortunately, they can't do everything they can to prevent. They protect you as best they can, but they are not going to prevent you from getting the virus at this point. Hat in hand or with 100% effectiveness. So, this is what we look at when we create these strategies, when we create these plans. We do the best we can to prevent it from happening, and we try to mitigate that damage as much as possible. And we have seen that being vaccinated and having your booster helps prevent severe illness and ultimately prevents death for the most part. So, it's incredibly frustrating. It's certainly a time to take stock of your family's mental health and, seek help if you need it. And, unfortunately, this is just becoming our new reality that we're going to deal with. And it's the next phase of our life here.
Mm-hmm. Really, it feels like the only way to prevent this from happening at this point is just to stay home. And we're learning new things too about masking, and that maybe those cloth masks aren't enough. What would you recommend?
I think, in the beginning, we were looking at a lot of supply chain issues, quite frankly, that, we thought that a cloth mask might be sufficient. It was better than nothing because we needed to save surgical masks, N95s, things of those nature for the health professionals that were treating active COVID patients. Supply chain has now caught back up. We do have more supplies available. I think it's time to seriously consider, at a bare minimum, wearing a surgical mask or a KN95 mask. It does get frustrating seeing folks walking around wearing their masks that I can still see your lips moving through them because they're made of mesh. At that point, you might as well not even wear it at that point, because you're not doing anything to protect yourself and you're not protecting anybody else. So there's no point in wearing it. Cloth is a step up, but I think the data is showing that you need something a little more protective than that. And I think the bare minimum is a surgical mask at this point.
You talked about chain supply issues. What about the status of rapid tests? Everybody wants them, but nobody can get one. So tell us where we're at.
Yeah. So, President Biden's bought over 500 million rapid tests. I think I saw an article yesterday saying he bought 500 million more. That doesn't mean that they've been delivered, that they're sitting on the White House lawn, that they're waiting for UPS to pick them up and ship them out. There's still issues of getting them distributed to where they need to be and out into the hands of the public. So that has impacted Indiana Department of Health supply. That's impacted our supply. We've had to modify our testing criteria for rapid tests to those that are 18 and younger or 50 and over. And right now, once rapid tests are gone, we do not expect resupply. So we're doing everything we can to try and preserve that inventory for those that really need it. It's nothing personal. If you come in and we tell you you're getting a PCR test, you're going to get a PCR test. That's all we've got to offer you. And obviously along with that is once you get your PCR test, it's highly recommended that you stay home until you get your results. I know that causes incredible hardships for families that need to get to school, that need to get to work, things like that. But that's how we curtail the spread. If you need a test, there's a reason you're getting a test. There's a reason you need to stay home.
Well, I was going to ask, is there anything that we can be doing to help make sure that we're not needlessly testing when it doesn't need to be, just to save on some tests? Like, what's the advice that you give? When should you get a test?
So, ultimately, the new guidance is that a test is needed 3 to 5 days after an exposure. If you're not symptomatic, and you probably know your exposure rate better than most people do. I could not tell you what Tammy's exposure rate was based on the generic information. The place where that would get sticky would be with students. They get the basic contact tracing. They have a lot of touch points during the day. They certainly are going to need to get tested. There's going to be some more unknown in that. But if I have lunch with a coworker and then they test positive, I know how far away we sat from each other, how much time we actually spent together, how likely it was that that person coughed during that time. Certainly we didn't share silverware or a beverage or something like that. So we could kind of, again, do a risk analysis of, is it likely that I was a true exposure, or can I wait until and see if something happens, So, but ultimately, we're going to refer back to the CDC guidelines and see what it says regarding your need for testing and quarantining. So at the end of the day, if you've got questions, that'd be the first place I'd recommend someone go and look.
Yeah, I know that hospitals have been overrun, especially with people who are going there to get tested. What else can we do to help our hospitals right now?
Unless you're seeking medical treatment, a hospital should be the last place you want to go to. They need to keep their tests for folks that are being admitted, that are seeking that higher level of care than they can receive at home. We've got 32 testing sites in the county. Most are all open with quite a bit of frequency. Most are doing everything they can to do walk-in times for everyone. Everyone's doing everything they can with the staffing they have to provide as many tests as they can. But it may require a trip to Boone County or Hancock or Marion. There's 169 test sites in central Indiana. It might be time to hop in the car and take a ride. I know that's not what anybody wants to hear, but IDOH is doing an amazing job out at Speedway, doing hundreds, if not thousands, of tests and vaccines a day out there. Yeah, you're going to wait, but you're going to get seen regardless. It's convenient. We try to make it as convenient as we can, but again, we're facing shortages everywhere at this point.
Well, speaking of IDOH, they're going to be setting up a free mobile testing and vaccine clinic in Carmel next week, correct?
That's right. They're going to be at the Jill Pullman Pavilion, which is just west of West Park in Carmel. They'll be there Wednesday through Saturday from noon to 8 p.m. each day. That's also across from University High School on 116th Street for folks. They will be doing vaccinations as well as testing out there. They said if they have rapid tests, they will administer them for those that are 18 and under and 50 and over, no exceptions. So, but if they're out, they will not have rapid tests at that point. They won't have any to give. So,
and do appointments need to be made for these?
You can make an appointment. They will take walk-ins when they can. I think folks need to remember that, it's cold out, and with Omicron spreading the way it is, sometimes waiting will be outdoors and you need to dress appropriately. We're making every accommodation we can to get as many people in as we can. But ultimately, you know, if someone has an appointment, they're going to get seen at their appointment time, and a walk-in will get squeezed in when they can. So,
Any other thoughts you'd like to leave us with this week before we head into the week ahead?
you know, we touched on it a little bit. It's the dark days of winter. Mental health normally takes a dive after, during, and after the holidays, anyways. It's a good time to check in on your friends and family, and you know, if you need help, don't be afraid to ask for it.
Fantastic. Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department. We'll check back in with you next week.
Thank you, ma'am.